Hello, and welcome to the 48th Annual AAKP National Patient Meeting, Transforming American Kidney Health. Patients take the lead. I am Dale Rogers, a resident of Idaho who has been fortunate enough to receive 2 kidney and a pancreas transplant. Furthermore, I am honored to hold the officer position of Secretary for the AAKP. Going into stage 5 kidney failure in 1998 has allowed me to see the many different sides of chronic kidney disease. I have experienced in-center hemodialysis, peritoneal dialysis, and transplants. Begrudgingly, I have had to also deal with the many of the known side effects of that plague the kidney and diabetic communities. Being an AAKP board member and ambassador has allowed me the privilege of being part of the many educational endeavors that AAKP presents. Healthline webinars, the Renal Life magazine, and the High Potassium Awareness Day, to name a few, besides this national patient meeting. Patient education is critical to the success and longevity in the personal care choices a patient will have to make along their journey. As a member of AAKP, I share the message that every kidney patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovation so that we are continually advancing care, improving treatments, and providing solutions for unmet patient needs. And when those innovations are FDA approved, it's critical that all patients have access and the right to choose the treatment that is best for them in consultation with the doctor they choose to care for them. So every patient can live their best life and achieve their aspirations. And with that, I am pleased to introduce our next session titled Sepsis Infection, the serious threat posed to kidney patients. It's my great privilege to introduce Dr. Leslie Wong. Dr. Wong is the Chief Kidney Health Officer and Senior Medical Director of Kidney Services for Intermountain Health, a nonprofit health system based in Salt Lake City, Utah. He also serves as Interim Senior Medical Director of Intermountain Medical Specialties, overseeing multiple services including nephrology, allergy, and immunology, dermatology, endocrinology, and diabetes, infectious disease, rheumatology, sleep medicine, ambulatory pulmonary medicine, and thrombosis and anticoagulation. Dr. Wong is currently a member of the American Society of Nephrology's Diabetes Kidney Disease Collaborative and helps guide nephrology innovation nationally as a part of ASN's Excellence in Patient Care. Personally, we are also honored to have him as a member of the AAKP Medical Advisory Board. Dr. Wong, welcome. I turn things over to you.
And thank you, Dale and AAKP, for inviting me to speak about this very important topic for kidney patients today. So I was asked to speak about the topic of sepsis, and specifically to address the question, are kidney patients at risk for sepsis? So in the next 20 to 30 minutes, we're going to go over what sepsis is and why you as a kidney patient or a family member or friend, loved one of a kidney patient needs to know about sepsis, all of its implications, and importantly, what you can do about it. So here are my disclosures. I'm an employee of Intermountain Health. I have a couple of consulting relationships, which have no bearing on this presentation. And I have a number of scientific relationships, including, I'm very happy to say I'm a member of the AAKP Medical Advisory Board. I serve on a number of committees for the American Society of Nephrology, or ASN, and I'm also a volunteer speaker for Sepsis Alliance. And NTDS is something that I think a lot of kidney professionals are aware of, but you as a kidney patient or family member of kidney patients need to know that Nephrologists Transforming Dialysis Safety is a national collaboration between the American Society of Nephrology and the Centers for Disease Control and Prevention to really prevent infections and promote patient safety for patients with kidney failure. And the Sepsis Alliance is a nonprofit organization that really focuses on public awareness about sepsis, providing education and support to patients and communities, and really dedicated to providing the tools and the resources so that the general population can get better information and knowledge about sepsis, and also importantly, providing support resources for patients, survivors, caregivers, and loved ones. And I'm happy to say that I am speaking on behalf of both NTDS and the American Society of Nephrology and the Sepsis Alliance. And both organizations are very happy and honored to be part of the AAKP national meeting. And I think not only is the topic important, but I think it's very timely. In fact, September is Sepsis Awareness Month, really with the saying of say sepsis and save lives. So if you want more information, you can go to www.sepsisawarenessmonth.org. So here are some important facts about sepsis. So did you know that sepsis is the leading cause of death in US hospitals? Sepsis affects an estimated 49 million people worldwide each year. But the problem is that 35% of US adults have never even heard of sepsis. And I think that's a really, really important reason why we're here talking about this topic today. At least 1.7 million adults in America develop sepsis every year. And at least 350,000 adults, that's people just like you and me, who develop sepsis will die during their hospitalization or go to hospice or end-of-life care. And when you look at the statistics, it's really alarming and also very sobering. Did you know that 1 in every 3 hospital deaths involves sepsis? And so here's, I think, some pictures that really put sepsis and the magnitude of the problem into a perspective that you or I can really understand and communicate to others. Every 2 minutes in the United States of America, someone dies of sepsis. We know that across the nation, the opioid epidemic and all the needless deaths from opioids are top of mind and really a target for our government, our public organizations, our communities to stamp out. But few people actually realize that more people die from sepsis every year than from opioid or drug overdoses combined. And I think as we are becoming very much more aware of the need to promote health equity within different communities, but particularly minorities, it's very sobering that Blacks actually suffer nearly twice the burden of sepsis than non-Blacks. So again, I think when you put all these things together and look at sepsis from a societal standpoint, it's a big problem that affects all of us. So what is sepsis? Now, if you look at the left side of the slide, you'll see some electron microscope pictures of some bacteria and viruses. And you probably have heard of these: Staph aureus, something that we often call MRSA, or methicillin-resistant Staph aureus, or MRSA. Streptococcus pneumoniae, okay, which a lot of us will call strep pneumo or pneumococcus. Influenza, COVID-19, we've all heard of these things. Why is this so important? Well, sepsis happens when an infection you have in your lungs, your skin, your urinary tract, your gastrointestinal tract, or somewhere else in your body triggers a life-threatening chain reaction in your body, okay? And while this usually involves bacteria, it can be involved with viruses and other organisms that enter your bloodstream and spread throughout your body. Now, most cases of sepsis start before a patient gets to the hospital. And this is, I think, an important theme that we're going to touch on over and over again during my presentation. Okay, so most sepsis starts before you're in the hospital, but it can also happen as a complication of being in the hospital. So I think this really underscores, the idea for kidney patients. First of all, stay out of the hospital, but when you start getting sick, that can lead to hospitalization. And the longer you're in the hospital and the sicker you are, the more likely you are to get sepsis. And I think without timely treatment, we need to let people know, you need to know that sepsis can rapidly lead to tissue damage, organ failure, and even death. So an important question to ask yourself is, how will I know if I have sepsis? Now, on the left side of the slide, you'll see a bunch of things that are really kind of medical jargon, right? So I, as a nephrologist and physician, I'll talk to the other doctors, nurses, and other health professionals talking about respiratory rate, platelet counts, creatinines, vasopressors. But these things aren't really things that that may resonate or make any sense to you as a patient or to a family member. So the right side of the slide actually shows some important things that anyone, even without medical training, can learn and understand to be potential signs or symptoms of sepsis. One is an abnormally high heart rate or weak pulse. So, if you take your pulse and things are normal, it's usually nice, slow, and steady. But all of a sudden, if your heart is racing, or you feel your pulse and it feels really weak and thready, that could be a sign or a symptom of sepsis. When someone is, normally, able to think and speak and converse normally, and even if they have maybe some memory issues, or they could have had some speech difficulties in the past, when they all of a sudden become very confused or disoriented, something different than usual, that could be a sign or symptom of sepsis. When you're experiencing extreme pain or discomfort, I don't mean just the usual aches or pains, or when you bump your elbow against, the door, not something like that, but something that really feels off. That could be a sign or symptom of sepsis. Fever, or having the chills. This can oftentimes be a warning sign of sepsis. So pay attention to that. And shortness of breath and feeling kind of cold, clammy, or sweaty. Any of these things in isolation, but particularly if you're feeling more than one of these, and even all of them together, you should really think about ask yourself the question, could this actually be something serious that could be an early sign of sepsis? So I spoke just a moment ago about the importance of timely intervention and recognition of sepsis. In fact, here's a mnemonic that I think can help all of us, not only patients, but healthcare providers, really relate to with each other and communicate about about how time is of the essence when you're talking about sepsis. And time stands for temperature, either higher or lower than normal. Infection, okay, which you may or may not have signs or symptoms of, but are important to recognize. Mental decline. We talked about confusion, disorientation, but when all of a sudden you're starting to feel confused or sleepy, or you notice a friend or family member, acting different, that's the M. And E, extremely ill. When you really say, I've been sick before, I felt ill before, but this is different. I feel something's really wrong. All these things, to either in isolation or together, really could be hallmarks of sepsis. And again, for every hour that treatment is delayed, the risk of dying from sepsis goes up as high as 9%. And we know, okay, that as many as 80% of sepsis deaths could be prevented if the sepsis is diagnosed and treated quickly. So I'm going to give you a quick test, okay? So there's no grades here, but I wanted to just point out a couple things and ask you, because if you answer yes to either of them, you're at a higher risk for sepsis. So any of you that know what the picture on the left is, what a photomat is, or maybe you've even gone to a photomat, you're actually at risk for sepsis. If any of you know what the bottle is on the right, it's something called insulin, and maybe you've used a syringe or you've helped someone else with an insulin injection, well, that person is actually at risk for sepsis. And while anyone can develop sepsis, people that are over the age of 65, that definitely remember what it was to use a photomat and regular film, right? Well, you're at a higher risk for sepsis. People with chronic conditions, diabetes, okay? Diabetes, which by the way is the leading cause of kidney disease and kidney failure, not only in the United States, but worldwide, you're at a high risk for sepsis. Lung disease, cancer, and again, it goes without saying, kidney disease. People who have had sepsis, survivors, people with weakened immune systems, which, again, chronic kidney disease, particularly if you're on dialysis, is a known risk, as a known cause of a weakened immune system. But what if you've gotten a kidney transplant and you're taking immunosuppressive medications that actually affect your immune system? Well, that increases your risk of sepsis. We already talked about when trying to, the important thing of staying out of the hospital, but when you're really sick for whatever reason, whether it's because of sepsis or not, when you get into that hospital, your risk goes up. And again, young children and others who are vulnerable. And so this is data from the United States Renal Database about patients on both hemodialysis and peritoneal dialysis that passed away in the year 2020. And I think there's a lot of data here, but basically I wanted to show you that the risk of dying from sepsis, whether you're on hemodialysis or peritoneal dialysis, is actually higher than your risk of dying of a stroke, of a heart attack, heart failure, or even cancer. And a lot of people don't realize that because, if you talk about, hey, listen, make sure that, you control your blood pressure, you don't want to have a stroke. Most people that have kidney disease or are on dialysis, they know about that. But how many kidney patients actually say, hey, something? I have to be careful about serious infection because sepsis could actually lead to death and serious illness. And in fact, if you add up sepsis, COVID-19, and other infections, 17% of deaths, whether you're on hemodialysis or peritoneal dialysis, are attributed to sepsis or infection. And we mentioned how having a compromised or a weakened immune system can increase your risk of sepsis. Well, we know that kidney transplant is the treatment, is the best treatment for most, not all, but most patients that have kidney failure. But while the overall risk of death goes down after a kidney transplant, the proportional risk of dying from sepsis actually goes up. So remember, if you're on dialysis, 17% of deaths are due to sepsis or some other type of infection. That actually goes up to 27% after a transplant. So your overall risk of dying goes down from all causes. So kidney transplants are one of the best things to help keep you healthy and living as long as possible. But sepsis again becomes proportionally a higher risk after you've gotten that transplant. And I mentioned children and sepsis. 75,000 children in the U.S. develop serious sepsis every year, and nearly 7,000 of them actually die. And again, a sobering statistic is that that's more than all types of pediatric cancer combined. And you can talk to your neighbor, your friends, your coworkers, and they all know about all the different initiatives and public awareness campaigns about avoiding treating childhood cancer. But we hardly talk about sepsis, and that's probably not accurate. And anytime a child goes into the intensive care unit, anytime we have a child who has a congenital heart condition, who's receiving a transplant, a stem cell transplant, for example, for leukemia, or if they're on a ventilator, this increases the risk of acute kidney injury and therefore increases the risk of sepsis quite substantially. And one thing that I think a lot of doctors are just starting to realize, and I'll share with you, is that acute kidney injury, that's what we used to call that acute kidney failure, okay? That is both a result and a cause of sepsis. So the figure on the left shows data from United States hospitals between 2009 and 2014. And nearly 50% of cases of sepsis are associated with acute kidney injury or acute kidney failure. Now, we used to think that the kidney was just a bystander, an innocent bystander, and just damaged by all of the different bad things that happen to your body when you're septic. But we actually now know, if you look on the right side of the slide, that acute kidney injury, when the kidney is damaged, it actually impairs your immune system becomes impaired. You may not be able to manage or excrete excess fluids and toxins. So this leads to swelling of the lung tissues, other tissues, and causes a tissue injury. There's an increase in inflammation that can also damage cells in your body. And I think, the most worrisome thing is that when that kidney injury, whether you're an adult or a child, becomes serious enough and people have to be placed on even just temporary dialysis, the repercussions and the effect of that is to actually increase, central venous catheters, which we'll talk about again shortly. But that also may introduce bloodstream infection and result in sepsis. So again, sepsis causes acute kidney injury, and acute kidney injury actually causes sepsis. It's a vicious circle. And there's a lot of data here, but I just wanted to show you from the pediatric standpoint, when researchers actually look at children who are hospitalized, and when children actually either require dialysis or they have kidney injury in the hospital, the risk goes up from 1% to 28% in terms of death. The cost of the hospitalization to the patient, to the child and their family goes up, nearly triples. And the likelihood of that child, if they survive the hospitalization, having chronic kidney disease after their discharge goes up nearly 5 times. So sepsis is bad for adults and children. Now, this is another slide from the U.S. Renal Data System, and really showing the different causes for hospitalization. And what I've highlighted here in the red is that when you actually look at specific reasons for hospitalization, infections are actually now going up. Part of this is due to the COVID era, but in fact, your risk for being admitted to the hospital for infection and sepsis is higher than for having a cardiovascular event. And indeed, if you are on dialysis versus not on dialysis, you have 100 times higher risk of having a staph bloodstream infection, which frequently leads to sepsis. And I think the previous slide underscored the importance of preventing sepsis and bloodstream infections, but there's even more at stake. I mentioned in an earlier slide the growing awareness and focus on the importance of health equity in terms of outcomes. Well, this affects sepsis as well. And in fact, this is data that was released by the CDC earlier this year. And what you see is that if you live in poverty, if you live in crowded household conditions, if you have less education, you are at a higher risk for sepsis. And in fact, when you look at Hispanics versus whites, blacks, and others, the Hispanic and black population actually have a higher risk of bloodstream infection and sepsis. So again, this is something that I think really, again, emphasizes the importance not only of we as healthcare providers and you as a patient community understanding what sepsis is, recognizing that there's even more at stake in terms of ensuring that we have the right resources to address these health inequities. And so when you're talking about dialysis and risk of infection, which is tremendous, again, 100 times higher, right? It really comes down to dialysis access. Many of you know what an AV fistula. Some of you may even have an AV fistula. That's a connection between a native vein and artery. And when you're on hemodialysis, has the lowest risk of infection. We talk a lot about central venous catheters or hemodialysis catheters as being bad. And there's a really clear reason here. When you look at the X-ray on the right side of the screen here, you see that the end of that dialysis catheter is really, it ends up right in your heart. And because of this, and because it can be a conduit for bacteria to enter your body, dialysis catheters have an 8 times higher risk of bloodstream infection compared to an AV fistula. And because you have a foreign body entering the skin, many of these dialysis catheters are tunneled in, kind of your upper chest area. These are some real pictures of how that tunnel, that exit site, can get infected and also lead to sepsis. And so what are the clinical presentations of sepsis and dialysis? NTDS, or nephrologist transformer dialysis safety, we've done a lot of work over the past several years, and we actually have a curriculum teaching not only patients but healthcare providers how to recognize sepsis and how to manage it. But fever is really, we talked about temperature, right? The T in time is a leading reason for patients with dialysis to go to the emergency room. And again, among the other things, right, that can cause sepsis, pulmonary, that's lung infections, urinary tract infections, skin infections, right? It's those hemodialysis catheters that are right there as a leading cause. And in fact, a hemodialysis catheter is one of the strongest predictors of sepsis when a dialysis patient goes to the emergency room or the hospital. And again, over half the cases of sepsis in dialysis are related to these hemodialysis catheters. Conversely, if you have an AV fistula and you don't, or a graft and you don't have a catheter, bacteremia and sepsis only occurs in about 15% of cases. And, we talk a lot about the importance of hand hygiene and surface decontamination. This is a study, I think, that shows you, it actually should make a lot of sense when you think about it. Bacteria live all over surfaces. So this is a study that actually did cultures of dialysis machines. And what you'll see, and shown on the right, we talked about about staph infections, right? Well, guess where you find the staph bacteria? You find it on the touch screens where people are touching the screen, the tubes, the poles, all the connection areas. You notice you don't see any staph aureus on the back of the dialysis machine because they're not touching it. But all those places where either your dialysis staff or even some patients, you'll see patients, some of you may have even done this where you reach over because the alarm is bothering you and you touch that screen. Well, that's where all those bacteria are actually living. And I think as we've tried to better understand and educate each other about where these infections come from, we've actually enlisted what are called human factors engineers. So, the picture on the left is something, again, this is pre-COVID, there's a gentleman sitting there, reading the paper, getting his dialysis treatment. But, people walk in and they don't realize how complex that dialysis procedure is. So when, we had engineers from Virginia Tech go to dialysis units all across the country, and this is actually a diagram from the University of Virginia. And it actually is, I know it's football season, but that's not a football play. That's actually a diagram of a dialysis technician or nurse actually providing a dialysis treatment. All those arrows represent where his or her hands could possibly touch and could possibly contaminate. So again, really emphasizing the importance of good hand hygiene, because we know that if we don't do that, the bacteria will actually get on our hands and will spread it all over the surfaces, and that leads to infection. And in addition to the complexities of what a dialysis treatment actually entails, we know that the treatment itself, the alarms that I already mentioned, the layout of the unit, sometimes hand sanitizer isn't always easy for you to reach. These are all things that lead to an increased risk of infection and sepsis. And we also know that sometimes, if you're having bleeding from your, like a lot of bleeding from your access, or maybe you're rushed to get out of there because your transportation is waiting for you. Sometimes, all these different factors, busy dialysis staff, you as a patient are rushed. These all kind of contribute to not only staff interruptions, but really poor communication between dialysis staff and the people they care about. These are common factors leading to infection. And I think one of the things that we've done at NTDS, we've had the opportunity and fortune to work with real patient advocates like Dr. Patrick G., Quinetta Taylor, who really have helped us learn and understand that it's really listening, empathizing, and building trust with each other that is really going to make the difference in preventing infections, and that patients have to be part of the team to prevent sepsis. So I wanted to shift gears a little bit and talk about transplant-related infections. We know that the transplant kidney is actually placed in the pelvic area, connected to the iliac blood vessels, and that's a picture here on the left. Now, the important thing about understanding sepsis in transplant is that there are different risks depending on how far out you are from the transplant. In the immediate post-operative period, so right after you get your transplant in the first month, there are a lot of infections that you have to worry about in terms of a surgical site. I've mentioned the risk of infection in the hospital, something called C. diff, which I'll talk about a little bit later. But again, coming in for your transplant, if you're not vaccinated for COVID-19 or you're not vaccinated for the flu, your risk of getting those things goes up. And those can actually manifest or get worse right after the transplant because of the immunosuppression. When you start going about 1 to 6 months out, then you start talking about these weird bugs, as we call them, but opportunistic infections, things like CMV, Epstein-Barr virus, BK virus, which normally people that are not immunosuppressed on transplant don't have to really worry about. But again, I've highlighted a couple of conditions here: flu, RSV, COVID-19, strep pneumo, which again are things that you as kidney patients are at risk of even without a transplant. And importantly, there are vaccines that can help prevent those things. I'm going to talk about urinary tract infection specifically, because this is something that once you get past the immediate post-transplant period, your risk as a transplant patient always is higher, and that's an important reason for sepsis. So I showed you the picture on the left already, and I did that on purpose because of where the transplanted kidney is placed in the body. Instead of being way up kind of in your flanks, up in your upper back, that kidney is right next to your bladder. So what that means is that any bacteria that gets in the bladder can easily move between the bladder to the transplanted kidney. So we know that nearly 30 to 40% of transplant sepsis admissions are from urinary tract infections. That risk is high, particularly in the first 6 months of transplant, and it's higher in women than in men for reasons that are anatomically explainable. But this is a big dilemma, and actually it's the topic of a lot of ongoing research to determine the best approach. What's shown here in this infographic is that this is a multi-center study where they looked, and in a lot of places they've given patients a lot of antibiotics, or they've screened patients after transplant for urinary tract infections, and as soon as they see some bacteria or some white cells, a lot of transplant centers have given people antibiotics. Well, this center actually randomized people to either treating with antibiotics if they saw bacteria, or just kind of only treating with antibiotics if there were signs or symptoms of an infection. And what they found was that there was actually no difference in the number of symptomatic UTIs. So like giving people antibiotics just because there's some bacteria in the urine didn't actually prevent the UTI in all cases. But what the result was that there was a much higher percentage of antibiotic use, and also much higher percent of antibiotic-resistant infections in those patients that got antibiotics, not because they had symptoms, but because they had some bacteria or abnormality in their urine. So, I've gone over kind of the background in terms of how serious sepsis is, why kidney patients, whether they're on dialysis or not, whether they're transplanted or not, are at a higher risk. So what can you do? What can we do to prevent sepsis? Well, number one, preventing other infections is really critical. Taking good care of chronic conditions and getting recommended vaccines are things that you can do, that you and your healthcare provider can do to prevent those infections that lead to sepsis. Because remember, sepsis isn't caused just by itself. It's always another infection that leads to the body's reaction. Okay. The second thing, and I mentioned this, the importance of hand washing as well as surface decontamination, is that we can't get rid of all the bacteria in the environment, but we can get rid of the carryover of the bacteria, which are our own hands. And again, if you have cuts anything that's exposed to the environment. And when we're talking about respiratory viruses like COVID or flu or RSV, wearing a mask. So anything that is a barrier, whether it's intact skin or a mask between you and harmful organisms, can help prevent sepsis. And I'm going to walk you through this really, it's a complicated slide, but I think it shows some really striking data. And I want to empower you and give you motivation and hope that you can control sepsis you can exert some control over your risk of sepsis by controlling your kidney health and other chronic conditions. The figure on the top of the slide shows that, the more chronic conditions you have, that's lung disease, heart disease, kidney disease, diabetes, the more conditions that you have, the higher your risk of sepsis. And in fact, if you have 3 chronic conditions, diabetes, hypertension, and maybe a little bit of lung disease, your risk of sepsis goes up 3 times. And if you have 8 conditions, it goes up 15 times. And when you look individually, okay, at the data, just having CKD more than doubles your sepsis risk. And I'm not going to read through all these conditions. And again, I don't want you to be discouraged because many people, for example, have a coronary artery disease. They're doing their best to try to, control their cholesterol, to quit smoking and doing these other things. But it really then, raises the question: if you, as a kidney patient, or if you have a family member who's got one of these conditions, boy, if they're smoking, if they're not taking care of their cholesterol, if they're not taking their blood pressure medications, these are all things that they can do that will empower them to address and improve their chronic conditions and potentially lower the risk of getting septic. So I would, ask you, talk to your healthcare professional about and get informed about the different immunizations that are recommended for kidney patients. And I think in this age of a lot of misinformation and very strong opinions, some not really based on science, I think knowing where the information is and getting informed is one of the best things that you can do, and your healthcare provider will appreciate. So I've got some websites here that I'm just going to walk you through, because after this talk, I'd encourage you to go and explore these. The ASN, the American Society of Nephrology, NTDS, has an excellence in patient care website, and all of the up-to-date adult and pediatric children immunization resources are there. So whether it's RSV, flu, coronavirus, all of these things are there for you to look at and even point out and share with your healthcare provider. The National Kidney Foundation has information focused really for patients and whether adults or children with kidney disease, kidney failure, or transplant. And I think these resources are available in Spanish, and the CDC has a really cool tool, which I'm showing you at the bottom here, called the Adult Vaccine Assessment Tool. It's also available in Spanish. You can actually go in there and just answer some simple questions: your age, like do you have diabetes, etc. And it'll actually tell you, like, these are the vaccines that are recommended based on your age and your conditions. So I encourage you to explore this and really ask those questions and get informed on your own. And again, if we want to prevent dialysis bloodstream infections, which are one of the highest risk, highest consequence conditions for our patients related to sepsis, think about, when you're in the dialysis unit, a lot of times people ask you to wear a mask. And one of the reasons is because Staph aureus MRSA actually lives on your nose. Okay, it's one of the highest concentrations of bacteria. I actually saw a video where a home hemodialysis patient was actually showing people, on YouTube, how she did her dialysis. What I noticed, though, is that when she was doing her connections, she had a runny nose and she kept rubbing her nose. And I was like, oh my goodness. I wonder if, she realizes that, she's actually getting bacteria on her hands. Dialysis catheters, we already talked about the need to avoid dialysis catheters as much as possible. The other thing is that, being informed that, the hub, right, the ends of those dialysis catheters is where bacteria enter your body. So the CDC actually has something called Scrub the Hub, okay, which requires everyone to wash their hands, and for the, again, having the dialysis staff really scrub the ends of those catheters with a disinfectant, right, with a disinfectant swab. These are things that you can talk to your dialysis caregiver about. They'll go, hey, listen, if I do have a catheter for whatever reason, I want to make sure that I appreciate that you're scrubbing the hub or asking them about scrub the hub. So really, again, the message here, catheters last and hand washing first. And again, we talked about the importance of, what we call the appropriate use of antibiotics, or in medicine, we're calling it antibiotic stewardship. So C. diff is an infection that you actually get from antibiotics, believe it or not. And this is where the antibiotics actually, they knock out all the good bacteria in your colon, in your gastrointestinal tract, and let the bad bacteria take over. So people that are older, that have been in a hospital or nursing home, have a compromised immune system. These are all people, kidney patients, right? Transplant patients, they can get C. diff, and this can cause not only a very severe diarrhea, but actually can cause a colitis that can end up requiring hospitalization. And I'll show you, a picture here of a culture result, and you see that this is a bacteria that is resistant to every antibiotic that we have. And you can only imagine the dilemma that we have as doctors, and the suffering that you have as a patient when you get sepsis and we have nothing to treat you with. So again, this is all, can trace back to improper overuse of antibiotics. So it's so important that you and your families realize and are empowered to be the first line of information, knowledge, and defense against sepsis. Here are a couple tools that I'm not going to go through in depth, but I've given you the website, the web links here. But how do you actually talk to your doctor, your nurse, your healthcare provider? How can I protect myself? How can I protect my family member from sepsis? Starting the conversation is the first step. Okay, we talked about the importance of being a team, right? Because if you can't listen, if you can't empathize with each other, if you don't have trust, there's not much teamwork there. These are all behaviors that doctor, staff, and patients need to actually participate in to prevent sepsis. So ASN and NTDS has a program called Let's Reset to help patients and healthcare providers get over sometimes those emotional barriers, or some of the, kind of the heat of the moment conflict that oftentimes arises when a situation, becomes, tricky during patient care. And these things can all lead to infection and sepsis. So I'm going to wrap up here and just remember this. When it comes to sepsis, it's all about time, temperature, infection, mental decline, extremely ill. So it's a great mnemonic for you to know. But the thing is that, remember, sepsis is a medical emergency. If you or your loved one have an infection that's not getting better or getting worse, take it seriously, act fast, get medical care immediately, and ask your healthcare professional, could this infection be leading to sepsis? And if the answer is yes, you should go to the emergency room or call 911. If you think you have COVID or a respiratory infection, or you know that you're at risk, put on that mask, wear it and protect yourself. All those barriers to microorganisms are going to help prevent you from getting septic. I want to thank AAKP for allowing me as a nephrologist, and we as Sepsis Alliance and American Society of Nephrology, to present this really important information about sepsis so that we can improve awareness and also help inform you about how to prevent sepsis and how you can communicate effectively and also clearly, and be empowered to do so with your healthcare providers about this important topic. So thank you again very much.
Thank you, Dr. Wong, for the important presentation on sepsis infection. I know we all took something away from it to educate ourselves and to help others learn more about the different sepsis symptoms so that we, as kidney patients, understand our risks. September is also Sepsis Awareness Month, so please visit AAKP's social media for more information, and also visit our allied partners at the Sepsis Alliance at www.sepsis.org.